Great. Thanks, Brittany. And thank you everyone for joining. Um, Tonight, we are going to talk specifically about a very important men's health issue, benign prostatic hyperplasia, or as we often refer to, BPH. So I hope this talk kind of provides some useful information and helps to answer perhaps questions and concerns that men often have as they start to develop some symptoms of BPH. So without further ado, let's get right into it. So I think Brittany has covered some of our salient points here. Again, my name, Thomas Will, and my background info, my office, as many of you know, in LaGrange, Illinois. Some of my special interests are listed and certainly does include BPH. Well, let's go right into our kind of overview here of the prostate gland. So the prostate gland is really, everyone always asks, how big is my prostate? What's a normal prostate? And you'll often hear physicians kind of generically say, prostate's about the size of a walnut. There's many sizes of walnuts out there, but about specifically 25 grams, it would be the volume measurement, weight measurement, or cubic centimeters, 25 cubic centimeters. So another way we refer to this. But the gland surrounds the urethra, as you can see in this diagram. It's just below the bladder. It produces fluid which transports sperm during ejaculation. So it serves a fertility role. And another question I commonly get is, Doc, I'm 60 years old. What is my prostate doing for me right now? Well, the answer is probably nothing very useful, because if you're beyond that point where you want to have children and you're not interested in fertility, the prostate is not serving an active role per se, because its main role is, again, to help with semen transmission. It does help with the ejaculation process, of course. So it becomes an issue for men as they get into their oftentimes 40-year-old age range, maybe even 50s for some men, because the prostate will start to enlarge. It affects, men differently, and some men have, and probably more commonly, the BPH condition, but there's also something called prostatitis, and that is an infectious process of your prostate gland, typically bacterial. And then, of course, we've all heard of prostate cancer, another condition that can affect the prostate. We will not be going into detail on that tonight. So commonly, as we kind of describe this benign prostatic hyperplasia, just means the gland has grown to a larger size. It unfortunately, as it grows, and as we saw in that diagram, it sits just below your bladder. And as it grows, it starts to pinch off that channel called the urethra. The prostate surrounds the urethra. And so the bladder is now working harder to try to get the urine out. And the prostate is acting as an obstruction to that outflow from your bladder. So we call this bladder outlet obstruction. And the symptoms it creates, we call lower urinary tract symptoms. Again, remember, BPH is not prostate cancer. So this is a totally separate entity, and it doesn't cause prostate cancer. There is some overlap with symptoms of prostate cancer, but I will tell you that most of the time, prostate cancer does not cause lower urinary tract symptoms or urinary symptoms. So I don't want men to come in and they're having problems with their flow, or they're going more frequently. And I don't want the first thought is this is cancer, because that is usually not the case. That would be more rare. although it can coexist with prostate cancer. And your urologist, as we do in our office, will certainly make sure if you're coming in for a BPH evaluation that we have looked into the cancer side of things, and we will give you reassurance that that is not a concern. We will look into that by checking your PSA level. We will do an exam on the prostate gland and sometimes other testing, such as an MRI or other novel testing that has come out. But that is something that we will certainly kind of rule out, so then we can focus on BPH. So we will rule out that cancer process. So let's look at a normal versus an enlarged prostate here. And as I mentioned, as that prostate gland enlarges, you can see that it starts to kind of narrow down the lower urinary tract there, that urethral tract. It starts to cause blockage at the outlet of your prostate. So what are some of the common symptoms of BPH? Most commonly, we hear men say, I'm going more frequently to the bathroom. Now, this can be daytime or nighttime. Sometimes nighttime is even more bothersome because you're sleeping and you don't want to keep getting up. So you notice that more often. There are multiple reasons that we can get up at night, but BPH is certainly one of the contributors. So we like to talk to our patients and understand how many times they get up at night and how often they're going during the day. Other issues could be a sudden urge to urinate, perhaps a weak flow, starting and stopping, hesitation where you have a hard time getting it started in the first place, feeling like your bladder just doesn't empty, and then feeling like you have to go back shortly thereafter and go again. And then that inability to urinate. So men who suffer from BPH certainly can experience a reduction in quality of life because nobody wants to get up repeatedly at night or constantly have this urge to go or look for a bathroom all the time. So it's not uncommon for our patients, up to 95%, to say, I don't like this. I don't want to live with these symptoms for the rest of their life. There are other things men have to deal with, like sexual issues. So it's important for us to understand, and this is why when patients come in, we do an inventory to assess their symptoms and understand how bothersome these symptoms really are on a day-to-day basis. So if you're over 50, BPH is the most common prostate problem. 50% of men by 60, 90% of men by age 85. You can see 14 million men have a report of lower urinary tract symptoms or difficulty urinating as they get older. And it's important to note that, a high BMI or obesity can increase the risk of BPH. So another reason for us to eat well, try to maintain an ideal body weight, get exercise, and all those things our doctors recommend. So as I mentioned, when somebody comes into the office, certainly we want to do a check on their prostate gland. We want to make sure that the prostate is smooth. We don't feel nodularity, something that would concern us for a cancerous problem. We oftentimes will also do some urinary output testing. So we'll make sure you can empty your bladder all the way. We have ways to test the strength of the flow as well. And then we do these standardized self symptom evaluations, such as the AUA score. So now we're going to get right into treatment options. And the first thing I always mention is let's look at perhaps what you are doing on a regular basis at home that could be contributing. What are you drinking, eating? What type of activities are you doing? Fluids and diet can play a big role. And certainly I like to ask questions such as, are you drinking a lot of coffee or tea? Are you consuming a high amount of carbonated beverages, soda, even carbonated waters? And there are other things that will prompt men to have to urinate more frequently perhaps get up at night. We all know sometimes drinking alcoholic beverages in the evening can prompt nighttime urination. So these are things we want to evaluate and inventory. We may make some recommendations based off that. And then we may go to our first line therapies. And so that could include a BPH medication. There are a number of medications out there. And these would include an herbal supplement such as saw palmetto or prescription medicines, traditionally Flomax, now generically called tamsulosin, and a host of other medicines in that class can help. And then there's also some novel treatments that we do in the office that can really help men with enlarged prostate conditions. And we're going to talk about the advantages of some of these treatments. But the first is Rezūm, which is a water vapor therapy. And the second one is a UroLift treatment where we use permanent implants. And then beyond that would be more surgical-based treatments under anesthesia. And this could include what's called a TURP, or a transurethral resection of the prostate, a laser surgery, even a prostatectomy, removing that whole prostate gland. It's important to note that there's really no dietary supplement or agent that is truly recommended for the management of lower urinary tract symptoms caused by BPH. And I did mention saw palmetto in there. It's the only supplement that really has any data, but it's conflicting data. And so in the long run, it's often not the treatment of choice. But some men like to try this because it is over the counter, and they seek this out on their own oftentimes. Let's talk about watchful waiting. So in addition to assessing behaviors, and we try to make some lifestyle modifications, as I mentioned, the types of fluid you're drinking, we may recommend you reduce caffeine intake, carbonated beverage intake. We may say reduce anything with artificial flavoring or sweeteners. Even the timing of what you drink. Try not to drink too much right before bed. Stay hydrated early in the day. And then we're going to watch these symptoms. So this is something that we do. Of course, what are some of the possible downsides? Well, symptoms may continue to get worse. Your prostate may continue to grow, and these symptoms and these interventions in the long run may not be powerful enough to control your symptoms. So we're moving into some medications. And I mentioned one of them. Traditionally, it's called Flomax in the past. That was the brand name. And what these medicines do is they usually relax that lower bladder, or more often that kind of intraprostatic smooth muscle. And as that muscle relaxes and opens up, it helps out with your urine flow and some of these other symptoms. You have to take the medicine every day for it to work. Some of the downsides would include a drop in blood pressure, especially if you already have somewhat normal to low blood pressure. And that could result in dizziness or lightheadedness when you stand up. Some men report problems with stuffy nose, occasionally fatigue, and something called retrograde ejaculation, where you do not see semen when you ejaculate. Another class called 5-alpha reductase inhibitors are designed to stop the prostate from growing or try to shrink the prostate. It has a hormonal mechanism of action. You have to take it every day, and it does take several months, perhaps 6 to 12, to have an effect of shrinking the prostate. It can help with symptoms. It's a very gradual improvement. Some of the downsides of this would be erectile dysfunction, or more often even a decrease in sex drive or low libido. And some men also notice from a hormonal standpoint, a little increase in the size of their breast, which may lead them to stop taking this medicine. I'd like to talk to you today about a treatment that is done in the office called Rezūm water vapor therapy. And this is considered a great treatment for men who are experiencing symptoms of BPH, who may not used other treatments. And what it is, it's an outpatient treatment where we use a small camera to look into the urethra after using lidocaine, which will numb up the urinary tract. Once the camera is in there, water vapor is pushed into the prostate tissue on either side, and that results in a reduction in size of the prostate tissue in the lateral lobes. And as the lateral lobes shrink, the channel opens back up. We do not do this under general anesthesia. In my office, we have an option to use nitrous, which many men use. As you know, that is something that is used in dental offices and other facilities as a simple gas you inhale. You do not fall asleep, but it does block any feeling of discomfort. Other men, we use local anesthesia only. It has a high success rate, and after about 5 years, only 4.4% requiring surgical retreatment. Some of the side effects that I counsel my patients on include afterwards, for a few days, discomfort or painful urination. We call this dysuria, and we like to give a medication to help minimize that or eliminate that for the first 2 to 3 days. You can't see blood in the urine. The urine may have a pinkish or reddish color. You also may see blood in the semen. Again, this is usually self-limiting. It is not harmful to you or your partner, but just something to be aware of. It is possible to have a decrease in the amount of semen, although most men still have antegrade or normal ejaculation. Urinary tract infection is possible. We do give an antibiotic during this procedure to try to minimize or eliminate that risk. And what I think is most common for men is after this procedure to have an urge to urinate. And I tell my patients for about 1 to 2 weeks, expect a feeling of kind of a partly full bladder and you have to go to the bathroom. It's not that your bladder truly is full, but you will have an urge as that prostate has just been treated with that vapor therapy and is starting to open up, and your body is adjusting to that. So here is a nice description of before and after of that large tissue that is getting opened up. We're going to see a quick video on how this works.
Rezūm water vapor therapy is a non-surgical treatment for BPH. Rezūm uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Rezūm is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Rezūm therapy lets you quickly return to normal activities. Talk to your doctor about Rezūm if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
Great. Okay. So an excellent procedure. 97% of patients would recommend Rezūm to a friend.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Rezūm when I was researching enlarged prostate and the procedures to repair it, to fix it. And Rezūm was one of them. The more I researched Rezūm, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Rezūm procedure was very good. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Rezūm procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Rezūm treatment has made a very big difference in our life.
Great. And so it's kind of nice to hear from a patient advocate who's actually gone through the procedure as Joe did. So I do want to cover some of those other options I had mentioned. And one of those is a prostatic urethral lift procedure. So what this is, again, it's in the office, outpatient procedure. We use a permanent implant that goes into the prostate to push that inner tissue back and open the channel so it no longer blocks the urethra. Again, under local anesthesia or with the use of nitrous, if preferred. There is about 13% retreatment rate with this procedure. And what that means is after an implant is placed, some tissue would fall back into that channel, some of that benign prostate, and need to possibly be retreated if that was the patient's preference. Of course, with any procedure, there's also possible side effects. And again, most of the side effects from an in-office procedure are relatively mild. Most commonly, that would include urgency to urinate for the first 2 to 3 weeks. You can have some blood in the urine for a few days and some burning with urination. Other possible issues could be a inability to urinate, the potential for catheterization, which would usually only be for 2 to 3 days. This green light laser therapy, who many people have heard of, is now moving into the realm of procedures that are done under a general anesthetic and typically done in a hospital or surgery center. And we're using now a laser fiber as we look into that channel, again with the camera, to laser that prostate tissue away. There's no permanent implant with a laser treatment. There is about a 4.8% retreatment rate in 5 years based on most studies. Some potential side effects would include some painful urination. That prostate tissue can be quite irritated after a laser treatment, and it does take some time for the tissue to heal. And so that could mean a few weeks of discomfort and urgency. There's also a possible risk of some scarring or narrowing in the urethra or at the bladder neck region. Fortunately, these are not very common. We talked about a term called retrograde ejaculation, and that is where when you have orgasm or feel like you're ejaculating, semen does not come out. That is a possibility with a green light laser or a TURP procedure. This is a depiction of a before and after by lasering the tissue open. And the prostate over here, we are trying to open that channel as wide as we can. And so let's move to the transurethral resection of prostate, or traditionally called a TURP. And this procedure has been around for many years. This has been a staple for urologists treating BPH. And although the technology has evolved and we have better instruments to perform it, the kind of method and mechanism is still the same. Looking in with that camera under general anesthesia and then using a heated wire, which is in the shape of a loop. And that loop will then shave out little rows of prostate tissue. So you're physically removing little pieces of prostate one at a time. It can be used for very large prostates, and it can be very successful in terms of opening the channel. It is, again, under a general anesthesia without a doubt, and we will put a catheter in after this procedure for at least 1 day, sometimes 2 days in our practice. The retreatment rate has been around 5.8% based on studies. Again, because we are opening that channel, you're going to have some burning or discomfort with urination for the first week or two. Also some urgency. This procedure might have more commonly some bleeding associated with it, which is why catheter placement can be important for the first 1 to 2 days. And sometimes that catheter will be irrigated at the hospital for the first 24 hours. There's a risk of some scarring in the urethra or at the bladder neck, like the laser. Again, it's not a high incidence. There also is the risk of retrograde ejaculation, or also called dry orgasm. The risk of erectile dysfunction is possible, but extremely low. Finally, we can talk about prostatectomy, and this would be saved for our patients who have extremely large prostates. Again, this is talking about benign enlargement. The entire prostate gland, or the vast majority, can be removed, but this would be done via traditional surgical approach using incisions, occasionally using a device called the Da Vinci robot, which would be closer to a laparoscopic surgery. This is by far the most invasive treatment we have for BPH. It is certainly done under general anesthesia, and you will have to stay in the hospital afterwards. It does an excellent job at removing the vast majority of prostate tissue, so their retreatment rate is very low. But there are more significant side effects, such as possible bleeding requiring a blood transfusion with infection afterwards as well. Urinary incontinence rates are higher with this procedure. Fortunately, this is not used very often nowadays. I'm going to sneak in one final treatment option, and that is called a prostate artery embolization. Again, something that has not actually been used for very long, can be used to treat larger glands, is done in the hands of an interventional radiologist. And they're trying to cut off the blood supply to the prostate. This is a non-traditional approach to treating enlarged prostates. But it's something, if a patient is interested, I can talk to them about. With any treatment, any procedure, insurance coverage is obviously important to our patients. And so we make sure that before any type of treatment is scheduled, that insurance coverage is verified for that patient, so they know it will be taken care of by their payer. So in summary, we know that BPH stands for benign hyperplasia of the prostate, and it's extremely common, affecting millions of men, and that it can lead to major quality of life concerns. Getting up at night is no fun. Looking for bathrooms when you're out and about all the time. Having to go back and forth because you can't empty your bladder. These things can be treated. And it's important to us as urologists to get ahead of this before it starts to have a major negative impact on the function of your bladder. Before the bladder muscle becomes too thick as it's trying to push urine out against an enlarged prostate. And that thickened bladder, muscular bladder, over time starts to lose capacity, the ability to hold urine, and eventually could lose function. And we like to keep our patients certainly away from having to catheterize themselves or have a catheter inserted in the hospital, the emergency room, or our office because the BPH has gotten to a severe level. So we're going to talk about treatment options like watchful waiting, behavioral modification, first-line therapies to include medications, Rezūm water vapor therapy, prostatic urethral implants in the office. And if needed, we will also talk about surgical procedures that are done in the hospital or surgery center, like the laser treatments for the prostate, a TURP, prostatectomy, or even embolization. I encourage anybody who is interested in learning more to consult with your urologist. I'd be happy to sit down and talk to people about what their prostate condition specifically entails after doing an exam, after doing some testing in the office if needed, and then going over these treatment options. We have 4 physicians in our group in LaGrange, and in our UroPartners larger organization, almost 60 urologists. And many of these urologists are well-versed in BPH and the treatment options available. All right, well, that wraps up my portion of the talk. And I guess, Brittany, I will hand it back to you for a minute.